Now let's take a look at how to find an ICD-10-CM code in the tabular list. So how do we find the code in the tabular list? Well, continuing on from our previous example of the infected right knee prosthesis, we went to the alphabetic index. Under complication, we found joint prosthesis underneath the first indent. Then we found infection or inflammation under the second indent, and then we found knee in the third indent. That is our starting point, essentially, for the tabular list, but it's not exactly our starting point. We first have to take a look at a couple of other things. When using the tabular list from the free PDF that is on cms.gov or the CDC, the first thing we're going to see are the instructional notations. And these are the same notes that you would see in the ICD-10 coding guidelines. So this is some additional information that we would find in this tabular list. Using the bookmarks here on the left-hand side, you can click right to the chapter that you need to go to. So we are using chapter 19, which is where we're going to start for our infected knee prosthesis complication. At the beginning of the chapter, you will find some additional information or notes about the specific chapter. Here we have an exclusion about birth trauma, obstetric trauma, that both of these codes could be included if these were related to that type of injury. And then it shows what the chapter contains. And this is some additional information before we start looking at the code we're looking for itself. And when we do go for the code that we're looking for, we don't want to go just to T84.5. We want to go to the 3-digit category code first, which is T84, complications of internal orthopedic prosthetic devices, implants, and grafts. Here you can see we have an excludes 2 note, and we know from our notes that an excludes 2 means they could both be coded together if the physician documentation includes that both items are coded together. Also at the 3-digit category code are going to be the notes about the 7th character. So here we know that we're going to need an appropriate 7th character to be added at the end of the code to indicate either the initial encounter, the subsequent encounter, or the sequela. Now we can go to T84.5. And T84.5, infection and inflammatory reaction due to internal joint prosthesis. We do have a note here that says to use an additional code to identify the infection. So not only are we going to need the T84.5 code, we're also going to use an additional code if we know the specific type of infection. But here we have T84.50 through T84.59, infection and inflammatory reaction due to unspecified internal joint prosthesis. That's not what we want. Internal right hip prosthesis. Well, we're not looking at a hip, so it's not going to be either of these two. Internal right knee prosthesis. Okay, here we go. That is that T84.53, infection and inflammatory reaction due to that internal right knee prosthesis. But we need that 7th character code to show our encounter. We only have 1, 2, 3, 4, 5 characters here. So now, in order to add that 7th character, we need to add a 6th character as a placeholder. So then that gives us our T84, which is our 3-digit category code. We have our subcategories 5-3 to show that it's an infected right knee prosthesis. And then we have to have a placeholder because there's no other subcategory beyond that, but we do have to have that 7th character encounter code in that 7th spot. D is the subsequent encounter, and that is where we usually have our folks because we are providing that subsequent level of care in the nursing facility setting. So we have our final code, T84.53XD, infected right knee prosthesis.